Hello, Year 11, and welcome to the next video that's just going to talk through the main developments of the industrial era in medicine. It's worth just getting a little bit of context to begin with about this time period in British history. This is during the Industrial Revolution. We see this is a period where technology is rapidly evolving. Towns and cities are booming. People are moving from the countryside into the cities, and we actually see the population of Britain from 1800 to 1900 almost quadruple. We're looking at a population of from nearly 50 million by 1900. So that has a huge impact on many things. So on the one hand, the technological developments of this era mean that there are lots of discoveries, lots of developments in medicine, in surgery, in understanding the cause of disease. So we have Louis Pasteur's germ theory. But on the flip side of that as well is we see a real change in the way in which the government operate. And we see a real desire and cry for heavier government intervention in people's lives because of the increasing population as time goes on. To kind of speak through this in a kind of chronological sense. There's a lot going on in this period. There's a lot of individuals. There's a lot of stories. So we're going to start with the earliest in the industrial era, which is that of Edward Jenner and the very first vaccination for smallpox. So Jenner is a country doctor. He's in Gloucestershire, and you may remember he notices that milkmaids in Gloucestershire would get cowpox, so a kind of similar disease to smallpox, but not as deadly, with like spots. He noticed that any milkmaid that got cowpox from milking the cows didn't seem to get smallpox. Jenner is not a scientist, he's a doctor, and doctors are very good at making observations, and that's what he does. He makes this observation. So he decides to test out his theory, and he tests out his theory of giving someone cowpox in order to prevent them from getting smallpox. This is very different to another theory that was popular at the time called inoculation, which was actually to give the patient the live disease. So many inoculators were giving people smallpox, rubbing smallpox scabs onto other people, and if you contracted the disease and your immune system fought it, you'd be immune from smallpox. More often than not, people died from inoculation, but nevertheless, it was a big business. So Jenner wanted to test that theory, but based on this idea of giving cowpox. He uses his theory on an 8-year-old boy called James Phipps. 2 weeks after administering cowpox to this young boy, the young boy is ill, but not seriously ill, and in the end, it seems that he doesn't contract smallpox. So Jenner has found the very first vaccination, and he calls it vaccination after the Latin for cow, which is vacca. What he does, though, is we see, as we saw in the Renaissance, we start to see a big push towards the scientific method, and he tests his theory. He tests it 23 different times. He gets the same result. He writes up his findings. He sends it to the Royal Society, obviously the institution we spoke about in the last video, who are the main institution about learning and progress and medical theories, and they reject his work based on the fact that he's a country doctor, based on the fact that the inoculators were making big business, and Jenner wasn't a fashionable London doctor. Some people also opposed the vaccination because it came from a cow. They didn't like the idea of being injected with an animal disease. And also there were some major early issues regarding the administering of the vaccination, sometimes that they weren't done correctly. But nonetheless, Jenner is able to open up a vaccination clinic. He offers vaccinations to children, free vaccinations as well. But the government are slow to act. It's not until 1853 that they actually pass a vaccination law, but it doesn't make them compulsory. It's not until 1871 that we see the first government law passed, which made the smallpox vaccination compulsory, with fines as well for parents for children. By 1980, smallpox is eradicated from the world. The only disease to be actually eradicated, and that is through that long process of vaccination. So a hugely significant moment in medical history, in British history. And what we know is that later on, Louis Pasteur and Robert Koch would also use the theory of vaccination to make vaccinations for other diseases later on in the 19th century. So we said at the start of the video, another key development is public health, and obviously the changing attitudes towards public health as well. We can always split the 19th century into two halves, really. So looking at 1800 up to 1850, and then 1860, and then kind of 1860 onwards. That's where we see the big change. Prior to the 1860s, and as the Industrial Revolution was taking place and mass urbanization of cities and towns was taking place, people were living in squalor. There was no taxation towards public health. There was no sewage system. There was no sanitation, no clean water, and London was plagued with waterborne diseases during the early 19th century. So particularly cholera and diseases like typhoid as well. The image on the right is a contemporary cartoon which is referring to the Great Stink of 1858, and this was when the River Thames, in a particularly hot summer, was just full of human and animal waste. And you can see there's like dead rats in the image, and death is essentially rowing down the Thames. You can see St Paul's and London Bridge in the background. It was at its worst at the Houses of Parliament. It was a really hot summer, so the windows were open, and this is when the government decided to start to act to improve public health. After that, we start to see real heavy government intervention. We see an end of laissez-faire, this idea of let it be, don't get involved in people's lives. We see huge differences. In 1867, working class men get the vote for the very first time, and they want change. They want public health, they want sanitation, they want clean water as well. So governments had to start listening to the electorate, to their voters, and had to start making those changes. In 1875, the Public Health Act is passed, and this gave government the power to enforce fines on town councils if they were not providing fresh, clean water and sewage as well. So that 1875 Public Health Act is a really huge moment in the history of public health, and the cholera outbreak stopped after that. I'm going to speak about cholera in a sec. Alongside that Public Health Act, we see the sewage system being constructed in London. So Joseph Bazalgette is the architect, and 83 miles of tunnels of sewage system are built, which washed away all of the waste. Now, just prior to that, in 1854, in the top left there, Dr. John Snow, who had a surgery in Broad Street in Soho, had noticed that lots of people were dying of cholera. And again, like Jenner, he used his skills of observation to kind of notice that lots of people were dying, who all seem to come from that pump, the Broad Street pump as well. So John Snow kind of used the scientific method a little bit. He mapped out Soho. He found that 500 people had died in 10 days, and he found the source of water that they were getting their water from was that one pump. He takes the handle off, and the cholera outbreak stops in that particular area. What they found was that a cesspit nearby had leaked into the pump, and people were getting their drinking water from, and their cooking water and cleaning water from that pump there as well. But this is a time before the 1860s where people still believed in miasma, and they believed that it was bad smells that were causing disease. So Snow was actually unable to convince people really to take this idea seriously, that he didn't necessarily know that it was bacteria, but it was so much more than simply miasma. He dies shortly afterwards, and there's actually another cholera outbreak in the same area in 1866 as well. So, but it's after 1858 with the Great Stink, 4 years later, that as we said, we start to see a real change in those attitudes. Public health changes massively. Another major change in the industrial era is surgery. The first image there is from the late 18th century, and this is typically what an operation would look like. You can see everyone holding down the patient who's screaming, and the amputation is taking place. Very little evidence of sanitary conditions or sterilization. They're not wearing medical gowns, and this is very typical, really. You might remember there's the surgeon Robert Liston, who famously would wear his blood-soaked clothes, showing how much experience he had as a surgeon. He could amputate a leg in 2.5 minutes. He once took off someone's testicles by accident. He once cut off the finger of someone holding the patient down. This is a time before anesthetics, and pain was a real big problem. That all changes in 1847 when James Simpson, he's a professor of midwifery at the University of Edinburgh. He's experimenting with trying to find a chemical to help women in childbirth, obviously due to the pain. He comes across chloroform, and chloroform was able to knock out people for a long period of time, although they were unsure of dosage to begin with. But it really was the first real effective anesthetic, and it didn't have any other side effects. Previous anesthetics that had been used, like ether and nitrous oxide, were either irritants or just not effective enough. But chloroform was extremely effective. Queen Victoria famously gives birth to her 8th child using chloroform, and she's quoted as saying, "Thank God for that blessed chloroform." But because chloroform was so effective, it almost became a danger, and surgeons, as a result, began to experiment with more complicated surgery because all of a sudden the patient wasn't screaming, they weren't having to hold the patient down, they had time to operate properly. But because they're going deeper into the body, and this is pre-germ theory, so there is not an understanding of germs, there's not an understanding of sterilizing of equipment, so more people actually started to die during the 1850s and early 1860s. And it's referred to as the black period of surgery. So chloroform actually at one point was not being used by surgeons because they feared, obviously, the higher death rate that was taking place. That though all changes again though when, after Louis Pasteur publishes Germ Theory, Joseph Lister, again a Glaswegian doctor, he sees carbolic acid being used to treat sewage waste in Carlisle in the northwest of England. And he thinks that this could maybe be a chemical used to stop the spread of infection as well. So the spray, as shown there, would likely spray a little mist over the operation. Also, they would soak ligatures in it as well, and thread when they were sewing up wounds as well. And it's effective. Within 6 years, the death rate from surgery reduces from 46% down to 15%. So already Lister had huge success in reducing death rates with his first use of antiseptics. That then leads on to this revolution in aseptic surgery. If something's septic, it's infected. If something is aseptic, it's not. So we start to see a huge shift in attitudes towards surgery and hospitals because of the work of Lister, and obviously inspired by Louis Pasteur and germ theory. So we start to see sterilization of medical equipment. So from 1887, all medical instruments had to be steam sterilized. We start to see the inclusion of rubber gloves from the 1880s, surgical gowns. It really has a huge impact on saving lives at the time. So the big changes to surgery is the use of anesthetics, an effective anesthetic in chloroform, and the effective use of antiseptics in Lister. Nightingale is one of the most famous individuals of the age, and she is massively important in changing the reputation and attitude towards nursing. She also does have an impact on hospitals, but it's really in the nursing field that she has a huge impact. She goes to the Crimean War in Ukraine in the winter of 1854. She's sponsored by the government because she's reading back home in Britain the kind of horrific conditions that the soldiers were in at the Scutari Hospital during the war. 80% of soldiers were dying from diseases, again, such as cholera. Now, Nightingale is a believer in miasma, so she does believe that infected air causes disease, and she's a big believer in cleanliness, scrubbing the floors and walls, big open spaces, open windows, again, linked to the idea of miasma, but still would have had an impact in actually changing the conditions of the Scutari Hospital as well, which funnily enough, was built on a cesspit, again, showing that lack of understanding of disease. She is a great administrator. She takes 38 nurses with her, although she rejects Mary Seacole, interestingly, 300 scrubbing brushes, and we start within 6 months, not just through her, but through a different change in attitude, the death rate in Scutari Hospital reduces from 40% down to 2%, because of those improved conditions. Changing the bed linen, feeding the soldiers nutritious meals, all have an impact there as well. But it's probably back home in Britain that she really has her biggest impact. She writes a book called Notes on Nursing in 1859, which set out the guidelines of how to be an effective nurse. Before this, the reputation of nurses was a negative one. People saw nurses as being drunk, lazy, gin, or just obsessed with gin, those kind of things. Nightingale changes that kind of reputation. She then, in the following year, in 1860, opens up a nursing school at St Thomas's, the old medieval hospital, again improving the training of nurses. And she really endorses and emphasises the idea of the pavilion model, which was like the big, wide open spaces of hospitals, different wards, different infections. So they are some of Nightingale's major changes. This is obviously pre-National Health Service, pre-NHS. So hospitals were around, but they weren't really effectively utilised. Most of the rich would have a physician visit them at home. So anyone who did go to a hospital, these hospitals were only generally formed through local taxes, like cottage hospitals, and donations from wealthy citizens who lived nearby as well. We talked about 1867, working class men getting the vote. In 1867, the poor law unions also begin. Again, this kind of idea of welfare for the poor, and they set up some hospitals, but again, they're quite limited. The final major thing to talk about regarding the industrial era, and we've already referenced him a few times, but that is Louis Pasteur, and this is a huge turning point in medicine, obviously, with his discovery that germs are airborne. 1861 is when Louis Pasteur first discovers the theory. By 1864, he has written and published Germ Theory, and it has a huge impact. He finds his discovery through animals. You might remember he experiments with silkworms and chickens with chicken cholera for him to finally able to prove his theory. The actual experiment is based on the swan neck flask. There was the theory of spontaneous generation, the idea that microbes just over time appeared in a substance. I guess you can make the links with miasma here, that infected air was causing something. And spontaneous generation is a really popular theory in the mid-19th century. Louis Pasteur doesn't buy it. He uses the swan neck flask because of the Industrial Revolution. They can change the glass in that sense to prove actually that its germs are airborne. This swan neck flask traps the microbes. The liquid in his swan neck flask doesn't disintegrate. The one that was open does. So thus he proves that spontaneous generation is incorrect, and that germs are airborne. It's Robert Koch on the right, though, his German rival, who is the man to actually identify specific bacteria that causes disease in humans. He used a purple dye to actually locate specific bacteria, and he's able to locate bacteria for tuberculosis. And what we then see is a huge rivalry between the two of them, using Jenner's vaccination theory to develop vaccinations for TB, for diphtheria, and rabies with Louis Pasteur as well. But really, truly is that huge defining moment when the four humours, miasma, and God are all proved to be false. It is germs that are airborne causing bacteria that cause disease. So that is the final video for the industrial era. Hopefully you found it helpful, and then tune in for the next video that talks about modern medicine.